The future of cancer treatment. Targeted antibody therapy is a new type of therapy that is being developed to improve the treatment of certain types of cancer. A field known as targeted antibody therapy is at the forefront of cancer treatment. Only recently has success in treating cancer and other diseases become commonplace in the field of oncology. Personally, I have benefited from this type of therapy and am still doing well after being diagnosed with bone marrow cancer. The difference in patient response between conventional chemotherapy and targeted antibody therapy is significant. As treatment progresses, the patient's side effects are minimal, and he or she can resume normal activities. What exactly is targeted antibody therapy? Targeted antibody therapy is a new type of therapy that is being developed to improve the treatment of certain types of cancer. It is a type of immunotherapy in which antibodies are used. Monoclonal antibodies are the most commonly used antibodies. They're the ones you see on TV, in movies, and in the notebook. These antibodies are used to target and destroy cancer cells while leaving healthy cells alone. What exactly is traditional chemotherapy? Conventional chemotherapy, also known as antimetabolite chemotherapy. Chemotherapy, or toxic chemotherapy, is a type of cancer treatment that employs the use of drugs to destroy cancer cells. Chemotherapy drugs work by interfering with specific proteins to kill cancer cells. The drugs accomplish this by interfering with chemical reactions within the cells. Chemotherapy is typically used when cancerous cells are confined to a single area of the body. The treatment is effective at killing cancer cells, but it is frequently ineffective against other types of cancer, particularly in other parts of the body. What makes targeted antibody therapy so revolutionary? Targeted antibody therapy is a new type of therapy that is being developed to improve the treatment of certain types of cancer. It is a type of immunotherapy in which antibodies are used. What distinguishes targeted antibody therapy from chemotherapy? Here's the distinction. Chemotherapy is extremely dangerous. Because the tumor cells are removed during treatment, the patient may experience immediate side effects such as nausea, loss of appetite, vomiting, and pain. Targeted antibody therapy focuses on the antibodies in the body rather than the cancer cells. Like most cancer treatments, antibody therapy has serious side effects. In my case, I became nauseous and experienced a headache, but in the long run, I found the symptoms to be worthwhile. It was worth the side effects so I could live, return to normalcy, and regain control of my life. Weight loss is one of the side effects. Despite the fact that I was losing weight, I had my normal appetite, which made me feel a lot better. So it wasn't as bad as you might think. My experience. On the spring of 2019, I was sick and tired of not feeling well. I went in for my monthly appointments and informed my doctor that I was experiencing extreme fatigue, memory loss, and an inability to function normally. In fact, I was having difficulty walking and going about my daily activities. We decided to run a battery of tests to figure out what was causing my current condition. In the past, many doctors diagnosed me with fibromyalgia and told me that the only thing they could do is provide supportive measures like pain medication, anti-anxiety medication, and a variety of other medications. This didn't help. I found myself in a difficult situation and eventually had to seek a more thorough workup and diagnosis. I was becoming weaker and sicker as the weeks passed, and no matter how hard I tried, I couldn't get back to normal. I ended up returning to my doctor's office and requesting a more thorough examination. As a result, I was diagnosed with acute kidney failure, as well as the underlying cause of my symptoms, multiple myeloma. Conclusion: therapy, when combined, can be a successful cure for some cancer cases. We can assist the patient in regaining control of their health and discussing the treatments that may be most appropriate for them. As a result, patients are advised to seek professional assistance for their specific cases. Prognostic anticancer therapy has advanced significantly in recent years. Anticancer therapy is a successful and life-saving treatment and can now provide a wide range of therapies. These therapies include a variety of treatments and services designed to assist patients in regaining control of their lives and in determining the best combination of therapies to reduce side effects and help the patient live a happier life. Patients feel more normal and live a more balanced and stress-free life.